I've been doing this type of work for many years, and what I have seen during that period of time in terms of the issues affecting our children, our most at-risk kids, are experiences and challenges that it is difficult for me to summarize to some people, to even begin to explain. The level of trauma, the level of psychosocial crises that these kids are facing.
A lot of our students come from neighboring communities, and a lot of the communities that are around school-based health centers deal with challenges around poverty, around unstable home situations, around lack of access to nutritious foods, to violence. And so we're able to see that and provide interventions that really do address those needs.
A lot of our students may have never seen a doctor. A lot of them have never received basic care, and it's very important for them to be able to come to La Clínica and get the services that they need.
Hi, I'm Karen Gold. I'm the nurse practitioner to be working with you today.
A school-based health center is a health center that provides healthcare services at the school site and is able to reach students directly because they're at a school site.
So we serve as a medical home and a reproductive health care home for many of the young people in our community. We serve as a mental and behavioral health home for many of our young people. And that is one of the most important because there is a very large gap in mental health resources for young people. And very importantly, we also serve as a dental home for our young people, as well as opportunities for youth leadership and development through our peer health, education training, and our outreach efforts.
As a parent, having the option to come to a school-based healthcare facility is priceless.
What is your daughter's name?
And this is close to her school, so she can come right out of class and come down here, or she can come during the school day if need be, and not miss, a great part of her learning time.
Health issues are always connected to academic performance just because students can have eye problems and they can't see the board and therefore they're not doing well, or they have hearing problems and they can actually hear the teacher and therefore aren't getting all of the material, or they have dental problems that distracts them from being able to concentrate on their work, or just minor pains. And for teachers to be able to kind of semi-recognize that there's something more going on and be able to immediately refer students to a clinic, that's really important because we're able to address their minor health problem and not have it deeply impact their academic success.
I'm a product of having a clinic in the neighborhood, and I have a full-time job, and I'm healthy. And when I have kids, I'm gonna make sure that my kids is healthy. And all of that comes from having different programs. We have different programs by people supporting. And so when you have different people supporting, that's putting money into different programs that's gonna help the neighborhood. In that neighborhood, you are building young people who are taking pride in themselves and taking pride in who they are and getting help with themselves. And them are going to be the people who are going to become doctors, who are going to be teaching their kids about how to take care of themselves. So it's the gift that keeps on giving.
We are very deliberately placing our centers in communities that have some of the worst health outcomes, that have some of the worst psychosocial stressors, meaning violence, drugs, poverty. All of those issues affect the well-being of a child. When you invest in a school-based health center, you're not necessarily investing in an organization or an institution. You're really, truly investing in the well-being of children.